So I didn't get diagnosed until I was trying to get pregnant, and that's normal, right? Most people with PCOS don't get diagnosed until they're actually trying. And my doctor just said, you need to be on Clomid. That's your solution. There's no nutritional changes you need to make. There's nothing
Oh,
else, right? That's not what they do. They give you the drug to get you pregnant. They don't take care of the root cause like you're talking about.
right.
But let's talk about the criteria. What should women be looking for as signs that they possibly have PCOS?
Well, the official criteria is not what everyone who actually agrees, everyone doesn't agree with them. But the official is that you need two of the following three. And this is as an adult. This would be like from around over 18 on. So there's different criteria for adolescents. But for an adult, you have to have two of the following three. You have to have messed up periods, so some kind of irregular cycle or none at all. And you need to have ultrasound imaging showing multiple tiny little cysts around the cortex or the outer rim of the ovaries, and or an elevated, this is a new added part of the diagnosis, anti-Mullerian hormone. So that's a measurable by a blood test, a hormone that's produced by ovaries, and that would be excessively elevated. Or the last criteria, which most of us feel should be part of this mandatory, it should not be optional, is evidence of androgen excess, either clinically or on lab testing. And that would be like high levels of testosterone. And that's what it's talking about, testosterone. And there's an adrenal androgen, which actually can give very similar look, but it's once again, an underlying etiology that's different, although they can overlap too. So it can be kind of complex, but you would have as manifestations of androgen excess. And you mentioned some of them, like you would have what's called androgenic alopecia, so really thinning and very of the hair on the head and very fine hairs, and ultimately patches where it's like not really patches per se, but areas where you have a lot of part showing because you can see a lot of scalp. So you have very thin hair and just less hair. And then cystic acne, they sometimes call it hormonal acne, tends to be on the jawline, and they're deep cysts, painful, scarring. They can give like pitting and all kinds of scarring from the acne. And that's really terrible. And then also excessive hirsutism, particularly like facial hair, like you have to shave or you have to have a lot of laser treatments. Sometimes excessive, like not just on the face, but like body hair. So you have a lot of hairy legs and arms even, and that type of thing. So these are like very, we'll say, esteem lowering kinds of symptoms, for a woman who is like going into her late teens and 20s, and she's embarking on her career and looking for potentially her perfect match in life and then starting a family, to have these kinds of symptoms. And as you mentioned, it's not part of the diagnosis, but 80% of women with PCOS also suffer from obesity, which it's like fuel to the fire, all of that excessive adipose tissue. So it's just really a life-altering condition, which can change how a woman looks at herself, her self-esteem, and the choices she makes in life. So it's really important to get on it early. The earlier you make the diagnosis, the better. But whatever point in life you're at, there's an enormous amount that you can do. And it goes way beyond, if you're not trying to get pregnant, just going on the standard treatment, which hasn't changed in like decades, which is birth control pills, metformin, and then plus minus spironolactone. I mean, that doesn't make sense from dealing with the root cause at all, because birth control pills, by their very nature, are pro-inflammatory. And the bodies of women with PCOS have a lot of underlying chronic inflammation that's driving insulin resistance and weight gain and mood disorders and just other things like general aches and pains, arthritis, and so on. So we definitely want to do more, as well as, I know this you deal with all the time, working on the gut microbiome. Unfortunately, hormonal contraceptives don't fix the gut microbiome, they can actually contribute to making it more abnormal or dysbiotic and increase the risk for developing autoimmune thyroid, or Hashimoto's thyroiditis, which is way higher in women with PCOS. So what my goal is, and working with individuals like you, patients can really see tremendous results, is always start with lifestyle first. And so first you have to define the problem, then you can find solutions that not just sometimes cover up symptoms. And I can't argue that birth control pills can sometimes cover up symptoms, but they're not actually getting to the underlying issues. And if you want to get pregnant, you go off of them, you're going to have to face the music, only it could even be worse music, more discordant music at the time you go off of them, because now you've altered your estrogen receptors, which already have problems, and so on. So we really want to try to find solutions that go to the root cause. And that's really been my emphasis.